Welcome to usmleTeam. Today's topic is celiac sprue. Important topic for step 1, step 2 and step 3. Just sit with me for only spend your 5 minutes to 7 minutes with me. You will come to know more important points about celiac sprue and other topics. Go through my other videos also. You can learn more important points that are very important, very important for your USMLE examinations. Not only for USMLE examination, for Australian examination, for UK and for other examinations too. So try to memorize the important points. I will try my level best to help you. Please let me know by subscribing, commenting and liking. Let me start. Okay, the important point about this is HLA haplotype DQ2 and DQ8 helper T cells mediate the inflammatory response. What is celiac sprue? It's an inflammatory process, right? In inflammatory response. So I will discuss it later. Let me tell you that remember about this DQ2 and DQ8, very important, and helper T cells. Sometimes they can ask in a step 1. Okay. Histological finding, very important for a celiac sprue. The absence of intestinal villi and lengthening of intestinal crypts. Because in USMLE they will give the history and they will tell you that which of the following could be seen on histology or in biopsy. So remember this: absence of intestinal villi and lengthening of the intestinal crypts characterized by the mucosal lesions in untreated celiac sprue. More lymphocytes infiltrate the epithelium. So intraepithelial lymphocytes. Destruction of the absorptive surface of the intestine leads to a maldigestive and malabsorption syndrome. Okay, clinically how the patient presents. Most important and most common symptom is of diarrhea, remember, and steatorrhea, flatulence, weight loss, weakness and fatigue. Severe abdominal pain can be there. Anemia. 10 to 15% of the patients will have anemia. They present with the fatigue, usually due to impaired absorption of the iron or folate from the proximal intestine, small intestine. In severe celiac disease with ileal involvement, absorption of the vitamin B12 might be impaired. So if they give which of the following cannot be seen in the patients with celiac sprue. Remember, if it's mild, vitamin B12 is not seen. If it's severe, if it involves the ileal, then you can see vitamin B12 deficiency too. But iron and the folate you can see because it's a proximal and it's most common, right? So by this we come to know that the other important point is iron and folate are absorbed from the earlier part, proximal part of the intestine, like duodenum and jejunum, whereas vitamin B12 is absorbed from the ileal. Okay, bleeding diathesis is usually caused by the prothrombin deficiency due to impaired absorption of the fat soluble vitamin K, right? The mucosa is not absorbing all the fat soluble vitamins, so you can have a bleeding diathesis. Osteopenia, osteoporosis, remember, very important. Sometimes in USMLE they will ask you, they give the history and which of the following could be seen after 50 years or in his old age. Hypocalcemia includes motor weakness, paresthesia with sensory loss, ataxia, seizures. If you want to remember, otherwise it's okay. Dermatitis herpetiformis, very important. How it looks, because skin lesions, we usually don't see the patients with these skin lesions because most of us don't know how to differentiate the skin lesions. Dermatology is very difficult. So try to by all these things, memorize, very important. Dermatological herpetiformis is a pruritic papillovesicular skin lesions involving the extensor surface of the extremities, trunk, buttocks, scalp and neck, and is associated with the 10 to 20% of the patients with celiac disease. Pruritic papillovesicular, PPV. Okay. Female can present with amenorrhea, delayed menarche, infertility in women, and impotence and infertility in male. Evidence of weight loss including muscle wasting and loose skin folds, orthostatic hypotension. Because of the fluid loss, they can have orthostatic hypotension, peripheral edema, ecchymosis, hyperkeratosis, dermatitis herpetiformis, chiliosis, glossitis, evidence of peripheral neuropathy, Chauster's sign and necrosis sign. Why? Remember about the calcium, that's very important. The interaction of the alcohol soluble gliadin in wheat, barley and rye products with the mucosa of the small intestine is crucial to the pathogenesis of celiac sprue. Look here, the wheat, barley and the rye, right? They are sensitive to the patients with the celiac disease, but not the corn. Remember, corn, corn. Okay. Anti-gliadin antibodies can be seen. Immunoglobulin A, IgA antibodies to smooth muscle endomysium and tissue transglutaminase. CD8 plus T lymphocytes. Make a note of this, very important. Okay, patients with the diabetes mellitus type 1, Down syndrome or a Turner syndrome have an increased incidence of celiac disease. Okay. The most sensitive, now the test, the most sensitive and the specific antibodies for the confirmation of celiac disease are tissue transglutaminase IgA, endomysial IgA and reticulin IgA, and correlates with the degree of mucosal damage. Very important, it can ask you in the examination. The oral D-xylose tolerance test, remember briefly I will describe, can reveal the carbohydrate malabsorption. So it's about the carbohydrate malabsorption. D-xylose is absorbed preferentially in the proximal small intestine and is excreted and metabolized in the urine. In untreated celiac sprue, urinary D-xylose excretion and the peak blood xylose levels are depressed. So what happens when there is no absorption of the D-xylose from the proximal small intestine because of the celiac disease? The level of D-xylose in the blood will decrease, right? And the excretion is definitely will decrease because it's not absorbed, so the kidney will not excrete because there is nothing in there. Okay, the radiological findings you can see is abnormal radiological graphic can include dilatation of the small intestine, coarsening of the obliteration of the normally delicate mucosal pattern, and a fragmentation or a flocculation of the barium in the gut lumen. I don't think so. It's a very important topic for this, a very important point you need to remember. It's okay, forget it. The upper endoscopy with at least six duodenal biopsies is considered the criterion standard to help establish a diagnosis of the celiac disease. The velar atrophic and the aura absent, very important, velar atrophic or absent with a decreased villus to crypt ratio, and the crypts are hyperplastic, very important. Crypts are hyperplastic whereas velar atrophic. Okay, CHVA. Okay. The cellularity of the lamina propria is increased with the proliferation of the plasma cells and the lymphocytes. The number of intraepithelial lymphocytes per unit length of absorptive epithelium is increased. Okay, the important point, try to memorize it, replay the video again to memorize, because learning by the video definitely will help you to memorize easily, right? Treatment, how do you treat it? Very simple, removal of the gluten from the diet is essential. So wheat, barley, rye, not the corn. Corticosteroids, sometimes you can use corticosteroids. So with this I'm done with this topic. Very important, try to remember the histological findings and D-xylose test and how do you diagnose, very important. Thank you so much for watching my video. Please do subscribe, rate and comment. If you have any questions, please do ask me. I will try my level best to help you. I will come up with more videos. Thank you.